Welcome to Atlanta, home to the Peachtree Road Race, the world's largest 10K. Because this stretch of the race is mostly uphill, it has been nicknamed Cardiac Hill. In this ICD-10 Insight, we will learn about myocardial infarction.
Most ST elevation MIs are caused by acute coronary occlusion. Traditionally, physicians are used to talking about them by the wall of the heart that's involved with the MI. It could be anterior wall, posterolateral, inferior. Each of these in ICD-9 has been assigned a specific code. In ICD-10, we're now transitioning to a capability of describing which artery is involved with the MI, which might be found on the cardiac catheterization at the time of doing a stent or doing a bypass. We will have codes for the left coronary artery with its left anterior descending, the right coronary artery, and the circumflex. Each of those is traditionally related to a specific wall. And so the description of the wall or the description of the coronary artery will lead to the exact same ICD code. We're looking at a branch of the left anterior descending artery, and within the artery we find that there's an atherosclerotic plaque. Once in a while there will be erosion of the plaque and finally rupture, with the disturbance of the blood flow will lead to the progression of a clot. And this is why people take aspirin instantly after having chest pain when you think you're having an MI, to be able to perhaps provide some protection from that clot. The occlusion of the coronary artery will lead to total obstruction of flow, and the muscle distal to that obstruction will die. This will lead to an ST elevation myocardial infarction of a branch of the left anterior descending. And that's how it should be described for ICD-10.
At DCBA, when you choose CDiTrax to track your CDI program, we walk you through the process from start to finish. The first step is a discovery consultation with your management staff. Here, we listen carefully for ways to optimize CDiTrax in your environment. The next step is implementing CDiTrax. We work closely with your IT staff to make sure the software is ready when you are. Once testing and installation are successful, we provide training to the documentation specialists and the CDI managers. Even after this initial training, we provide ongoing support to ensure that everyone on your team feels confident using CDiTrax. If you'd like a demo of CDiTrax, please email us at support@dcbainc.com.
Lisa has a question about gangrene, diabetes, and peripheral vascular disease. She writes, "There's an old coding clinic that says, in a patient with diabetes, if there is no other cause and effect relationship established for gangrene, then it should be coded as a diabetic complication. So if I have a patient with diabetes, peripheral vascular disease, and has an amputation for gangrenous foot, should I code diabetes with vascular manifestations as principal and atherosclerosis as secondary? What do you suggest, Dr. Gold?"
Thank you for the question, Lisa. When you deal with a patient with diabetes and the manifestations of necrosis of a foot or a diabetic ulcer, you have to consider what it is that the patient is in for. If we're dealing with the possibility that somebody who has diabetic microvascular disease might benefit from increasing inflow by doing a bypass, femoral popliteal bypass, aorta bifemoral bypass, to increase flow to the leg, then the principal diagnosis will be your 440 series for atherosclerosis of the leg, because you can't operate for diabetic microvascular disease. If the patient is having an amputation, on the other hand, then the diabetes with microvascular disease can be your principal diagnosis.
Any registered user of CDItalk can post a question. Let me show you how. Go to CDItalk.com and enter your username and password to log in. Click on the Forum button in the navigation bar. Once the page opens, then click on Ask Dr. G. To ask a new question, click on Post New Thread, enter a subject in the title box, and then type up your question. Scroll down and click on the subscription box so you will be notified when your question has been answered. Then you'll click on Submit New Thread. Once this message appears, you will know that your question has been submitted for moderation. Please note, your message will not be visible until it is approved. If you have any questions about how to post, contact me at ssuggs@dcbainc.com.